Hello, my name is Carmela DeBeer, and the nursing issue that I will be addressing today is compassion fatigue in trauma and critical care nursing. What is compassion fatigue? According to Schmidt and Hagel in 2017, compassion fatigue by definition is defined as an extremely tense feeling experienced by those who care for people who are in distress, and it is measured by three components: burnout, secondary traumatic stress, and compassion satisfaction. The reason that compassion fatigue is an issue in today's society is because nurses who work in high stress areas and with high acuity patients, such as in the trauma bay and ICU, are prone to develop compassion fatigue, and most will experience this sometime in their nursing career. Also, increases in compassion fatigue lead to burnout and poor nursing retention. High levels of stress can lead not only to compassion fatigue, but also to depersonalization. And finally, institutional awareness and implementation of recognition programs, along with coping mechanisms, can help lower the rates of compassion fatigue and increase rates of compassion satisfaction, which is the joy that nurses derive from taking care of patients in their time of need. So, why is compassion fatigue such an important issue in my own nursing journey? A little bit of background. For nearly 12 years, I worked in the burn ICU. About 6 years into my career, we joined the burn ICU with the pediatric intensive care unit. So I also took care of many pediatric patients as well as many pediatric burn patients. And as a trauma nurse specialist for the last 2 years, I am the one that takes care of all the trauma calls. So gunshot wounds, MVCs, suicide attempts. I see all the traumas that come through the trauma bay. So in doing so, I have experienced lots of traumatic and tragic deaths. Um, we see many, many, many things that no one else, even other nurses, see, especially as a trauma nurse specialist working MVCs and suicides. Um, we just have a lot of interaction with patients who have injuries far beyond those of other patients in the hospital. And also, we see them as they come in. So we don't see them bandaged and the wound covered. We see them when they come into the bay. So sometimes that can be a hard thing to experience. And we see all ages. And then finally, it's so important to me because I came from a unit in the burn center and now also in the trauma um, program that takes care of their own. We are so fortunate to have a great team. When I worked in the burn center, I worked nights, and we just had a team that we all got along. We knew each other. We worked together for a long time, and we did a really good job of taking care of one another, and even the unit as a whole. If something happened and we were struggling, or multiple ones were struggling, or maybe it was just one person that we worked with was struggling with something that had happened with a patient who had died or a situation that was tough, we all came together. And we did this in a variety of ways. We did very informal debriefings. The chaplain would come, we'd put a paper up in the unit that said we were having a debriefing and what day and what time. It was voluntary. The chaplain would start it out by saying a prayer. He usually kind of reminded us of what we do is not work that everybody does, and it is hard and it does take its toll. And we kind of had a brief overview of the situation. And then we went into just a period where we were able to talk if we wanted to talk. Some people talked, some people listened, some people didn't need to vent. They just needed to be there as a support, and they felt like just being there to support their fellow coworkers was enough. Um, then there were times when just on night shift we would have something happen or a death or something that got to one of us or all of us, and we would go down and grab breakfast and come up to the break room and just talk about it and decompress and get rid of that anxiety and those feelings that we had, and allow ourselves to just kind of have that moment to debrief. Again, just so very informal. And then finally, as a trauma nurse specialist, there's just one of us on at each shift, so we hand off to each other up in our office. And in doing so, there's many days when we'll sit there if we don't have a trauma come in, and we'll talk about the night and we'll talk or the day and talk about what the patients were that we had. And if there's something that bothered us or a really hard case or a really hard patient, we have that time to kind of just debrief with the two of us. So that's why this is important to me, because I truly feel that nurses in the ICUs and nurses in the trauma bay especially have such exposure to such extreme cases, as do the ED nurses and oncology nurses. I mean, we all do. But it's so very important to recognize when there is that compassion fatigue that's happening, when things have gone a little too far and things have built up and you have that compassion fatigue. And it's so important for our institutions to recognize this in their employees and put together those debriefings and those ways of decompressing. And that's why I picked this subject, because it really is one that's very close and personal to me. So, what are the symptoms of compassion fatigue? It's important to know these, and to recognize them in your coworkers, and on your unit, especially if there's times when you have a lot going on and everybody, is involved in what's going on in the unit, and it takes a toll on people. Just recognize these symptoms as they occur, and be there for these coworkers. So the symptoms are sadness, depression. They may have some sleeplessness going on. And then the big ones are anxiety. They may start to have anxiety and just those feelings of loss of control. They may have a loss of the capacity to nurture, so that depersonalization. They just can't quite get there anymore. They can't give their all to the patients that are in their care. And then finally, they may have feelings of failure as a nurse and in their profession. So it's very important to recognize these. Hopefully, we recognize them early on. Peer-to-peer support is great, but institutions need to recognize this in their employees also and provide ways of coping for those employees going through this. We've already established that compassion fatigue does affect nurses that work in high acuity, high stress areas. And Berg et al. In 2016 looked at compassion fatigue and burnout in the trauma team. And they asked them what were some things that were stressful to them? What were some of those stress triggers? And these are 4 things that came up as rating the highest as far as stress triggers within the trauma situation. The first one was children. So either accidents, injuries, or deaths of children. The second one was family members. So those traumas that came in to the trauma bay and then went up to the ICU to be cared for, that included and encompassed multiple family members. The third one was avoidable situations. So this may be the trauma patient that rolls into the bay from an MVC because they were texting while driving. It may be the trauma patient who comes in who may not be that injured, who was the one driving and texting, but who has killed somebody on the scene. And you know that, and you have that in the back of your mind while you're dealing with this patient who has no idea that their actions have caused that. And then the last one was a similar personal experience. So, speaking from my own personal experience, I can tell you that when traumas come into the bay and they involve children that are my children's age, which my kids are older, they're in their early 20s, that clicks in your mind like, wow, this could be my child. Or if there's situations where kids are just on the wrong path and they're doing the wrong thing and they end up doing something that causes them to have an accident and causes them to be there in the trauma bed, in the trauma bay, and you think, gosh, they're my kids' age. They have their whole life ahead of them, and look what track they're taking. So these are all just triggers to kind of be aware of, that can lead to that, triggering that stress and that compassion fatigue in nurses. So as healthcare professionals, we need to be aware of what compassion fatigue is. And as we said, it's that extremely intense feeling experienced by those who care for people who are in distress, and it's measured by 3 components. Those components are compassion, satisfaction, secondary traumatic stress, and burnout. So, compassion satisfaction is that meaning and joy that nurses derive and get from taking care of patients in their time of need. So, when you have compassion fatigue, that compassion satisfaction goes down. You're not able to have that joy of taking care of patients because you're so burnt out yourself. And you're so just empty from giving and seeing so much and not having an outlet to cope with that. Secondary traumatic stress is a feeling of despair that can lead to feelings of not only despair, but it can elicit physical and psychological symptoms. So, sleeplessness, anxiety, all those ones we talked about. You just get so down that it affects your whole life, not just your work life, but your work life, your personal life, everything you do. And then finally, burnout is directly linked to your work environment and your job satisfaction. And studies have shown that people that experience compassion fatigue not only have lower compassion satisfaction, but they also have higher burnout. So it's important to try to remember these different components of compassion fatigue and try to catch them early on. And again, we'll talk about it here in a minute, but it's so, so important for employers to recognize and act quickly when dealing with compassion fatigue in their nurses. So, where do we go from here? It is very important to recognize compassion fatigue. It's important for us to be able to recognize it not just on a peer to peer level, but on an institutional level, and to provide coping mechanisms for our staff members so that we can be a team that is healthy and that each nurse has available those coping mechanisms that she needs or he needs to be able to do their job effectively. And part of that is accepting and acknowledging on the part of the institution and on the part of the nurses in general that compassion fatigue does exist and that it should be expected, especially in the trauma profession. And then we need to educate the team on how to recognize symptoms, not just symptoms in your peers, but symptoms within yourself. So, hey, I've had 3 deaths on the unit this week and it's been really hard on me. Or I had a car crash come in and there were mom and dad died on scene and the 3 kids came in and they're all in critical care. It's just knowing those situations when, it would help to talk. And it can be peer to peer, it can be informal debriefings, formal debriefings, or it can just be having mechanisms, having ways to cope and decompress, and knowing what those are, and those be being provided by the institution for their nurses. And then we need to embody professional stress relief coping skills as a team. So coping needs to be a team effort. You have your team that you work with. You have your peers. And you need to take care of one another, because for a team to function well, all the members have to be whole and healthy and satisfied with the job they're doing. So it's important that we work together to recognize symptoms within our team, and then as a team to help get each other through those situations. And our leadership, it needs to make social support a priority. They need to develop programs to help the nurses that are experiencing compassion fatigue to deal with it. And better yet, to catch issues early. Have those informal debriefings. Have peer-to-peer programs to catch it when it's starting, so that we don't get to the point of having compassion fatigue. And then engage in team discussions regarding coping and regarding what's going on. And then be proactive in responding in high stress situations. For example, you have a house fire and you're a nurse in the burn center. There's a house fire. 6 family members come in from the house fire. Mom dies, the 2-year-old dies, and the little 3-month-old baby dies. So you have dad and 2 siblings that live, and they have severe burns, and now you have to take care of 3 major burns, 2 of them children, all the while having the family members coming in who are wanting to help be there and support their family members, but also knowing that they've lost 3 other family members. And you as the nurse are having to just pull everything within you to keep it strong and to be there for that family. That is a high stress situation. And it's important that your leadership recognize that and get the resources you need down there to you in the morning. So maybe it's over the night shift, and in the morning, your leadership needs to be there. They need to say, whoa, this is a high stress situation. This shift, this group of this team went through so much last night. Let's get them some support. It may be your manager saying, hey guys, how are you doing? Or the chaplain coming down and saying, do you guys get to talk? Do we need to do a little informal debriefing? It's just checking in with your team and realizing something's happened. Let's make sure we're all okay. And as nurses, it's checking in with each other. Boy, that was a hard night. We went through a lot, or it really bothered me, or I just feel like I can't go home and go to bed because I keep thinking about it. And talking about that, having that interaction between one another to help kind of decompress the situation before you take it home with you. We're never going to get rid of all those feelings, but just talking about them helps. And then emphasize the positive aspects of patient care. Encourage your nurses to be mindful and to celebrate successes in patient care. Remember that one situation, or those 2 situations, or the 5 situations that have built up over the last month that have got you down and feeling like you're just overly stressed. That doesn't define you as a nurse. What defines you is the amazing care you've given to not only those patients in those traumatic situations, but to all the patients that you care for across the board. And to remember, you are there to be such an integral part of that patient's experience. And you are needed, and you are special, and you should be celebrated. So again, very important just to celebrate those successful interactions and encounters. So in summary, recognition is the key. First, we want to recognize those symptoms that we talked about. Early recognition is great because if we can get to those nurses who are kind of experiencing those stressful situations before they start to pile up and lead to that compassion fatigue, we can sometimes keep that at bay. So recognize the symptoms, just, have that conversation. Hey, are you doing okay today? Something as simple as that can lead to a very positive interaction with your coworker. Also, timely intervention. So the situation with the house fire that I gave you a little bit ago. If that happens on Wednesday night and you get off on Thursday morning, your leadership needs to be there. They need to be saying, "Hey, I know you had a really tough night. You guys want to talk about it, or is there anything you want to talk about or need to talk about?" It doesn't need to be something that's said 3 weeks down the road. Hey, let's have a debriefing about what happened 3 weeks ago on Wednesday. Timely intervention is the key. It's letting it not get to us and fester and grow and grow and grow and bother us more every day. It's getting in there and talking to each other. Nursing is a team sport, and you need to take care of your coworkers and you need to take care of yourself. And so that healthy communication, it may be saying, "Hey, are you okay?" Or it may be saying, "I had a really tough night. My patient died and it's really bothering me and I just kind of need to talk about it." It could be very informal, peer to peer. It could be an informal debriefing. It could be talking to a chaplain or talking to one of the social workers that happen to be there. It it can be whatever you need it to be. And it doesn't need to be something you're ashamed of. You know, we go through as nurses so much. We see so much and we deal with so much. And sometimes we forget, hey, the rest of the world doesn't see and deal with everything we see and deal with. And so we forget to take care of ourselves because nursing is such a giving profession. We give and give and give and give. And if we're not careful, we give till we're empty. So we need to refuel. We need to have those conversations that kind of build us back up and we need to know more than anything, it's okay. It's okay to feel down. It's okay to feel stressed. It's okay to cry. If you need to just let out those emotions. Um, but that's why we're here. We're here to help each other. So I hope you've enjoyed this presentation. I hope that the information that I provided is information you can take back with you to your place of work, to your nursing journey, and look for those signs in the people that you work with. Take care of each other. Because many times in nursing, our team or our group that we work with, that's who we have to rely on. We always hear nurses say, "Oh, my family's not medical. They don't want to hear what I have to say," or "My husband doesn't understand." And it's true. We are the only ones that can understand what each other goes through. So be there for each other. Recognize the symptoms. Get in there and ask, do you need some help or do you want to talk? And then just have that communication. Thank you so much for letting me present this topic to you.